In the world of medicine, we often talk about a heart attack, a sudden and life-threatening event. But there is another, equally urgent crisis that we must all be prepared for. A brain attack. This is what we call a stroke. It happens when the blood supply to a part of the brain is suddenly interrupted or reduced, preventing precious brain tissue from getting the oxygen and nutrients it needs to survive. Without this vital blood flow, brain cells begin to die within minutes. This is not a minor event. It is a major medical emergency that can lead to permanent disability or even death. Every single second counts, and understanding the gravity of the situation is the first step towards saving a life, possibly your own. The impact of a stroke can be devastating, not just for the individual, but for their families and communities. In the United States alone, someone has a stroke every 40 seconds. That adds up to nearly 800,000 people each year. What's more, for those who survive, the road to recovery can be long and challenging, as stroke is a leading cause of serious long-term disability. It can affect your ability to walk, to speak, to remember, and to live independently. The damage done during a stroke is directly related to how long the brain goes without blood. This is why public awareness and immediate action are our most powerful weapons in this fight. There are two primary ways a stroke can occur. The most common type, accounting for the vast majority of cases, is an ischemic stroke. Think of this like a plumbing problem in the brain's intricate network of blood vessels. A blood clot forms or travels to the brain, creating a blockage that cuts off blood flow downstream. The other type is a hemorrhagic stroke. This happens when a weakened blood vessel in the brain ruptures and bleeds into the surrounding tissue. The leaked blood creates pressure and damages brain cells. While less common, hemorrhagic strokes can be particularly severe. Both types are emergencies, but they require different treatments, making a fast and accurate diagnosis at the hospital absolutely critical. It is a common misconception that strokes only happen to the elderly. While the risk does increase with age, a stroke can happen to anyone at any time. We are seeing a concerning rise in the incidence of stroke among younger and middle-aged adults, even in children. Factors like high blood pressure, diabetes, obesity, and high cholesterol are significant contributors, and many of these conditions are on the rise globally. This makes it more important than ever for people of all ages to understand their personal risk factors and, crucially, to know how to recognize the warning signs of a stroke when it happens to someone around them. The power to act begins with knowledge. Recognizing a stroke quickly is the most important factor in a positive outcome, and thankfully, there is a simple tool to help you remember the most common signs. It's an acronym called Be Fast. This easy-to-recall guide can help anyone, with or without medical training, identify a potential stroke and take immediate action. The B stands for balance. Has the person suddenly lost their balance or coordination? Are they feeling dizzy or struggling to walk straight? A sudden onset of these symptoms is a major red flag that something is wrong within the brain's control centers for movement. Don't dismiss it as simple clumsiness. It could be the first sign of a brain attack. The E in Be Fast stands for eyes. Ask the person if they are experiencing any sudden changes in their vision. This could manifest as blurred vision, double vision, or a complete loss of sight in one or both eyes, almost like a curtain coming down. The visual pathways in the brain are extensive, and a disruption in blood flow can easily affect them. Next, we have F for face. Look at the person's face and ask them to smile. Does one side of their face droop or seem numb? An uneven smile is one of the most classic and recognizable indicators of a stroke. This facial weakness is a clear signal of neurological distress. The A stands for arm weakness. Ask the person to raise both of their arms. Does one arm drift downward, or are they unable to lift one arm at all? This weakness or numbness often affects one entire side of the body, so it might also be present in their leg. This one-sided paralysis, or weakness, is a hallmark sign of a stroke, as one hemisphere of the brain controls the opposite side of the body. Then comes F, which stands for speech. Is the person's speech slurred? Are they having trouble speaking? Or do they seem confused and unable to find the right words? You can test this by asking them to repeat a simple sentence, like, "The sky is blue." Finally, and most critically, the T stands for time. If you see any of the signs from B, E, F, A, or S, it is time to call emergency services immediately. Do not wait to see if the symptoms improve or go away. It's also incredibly important to note the time when the first symptoms appear. This piece of information is vital for the medical team at the hospital, as it helps them determine the best course of treatment. Acting fast is not just a suggestion, it is the most crucial step you can take to save brain cells and improve the chances of survival and recovery. In stroke treatment, there is a golden rule that every emergency physician, neurologist, and paramedic lives by: time is brain. This phrase powerfully captures the reality of a stroke. For every minute that blood flow is blocked, the average patient loses nearly 2 million brain cells. These cells, once lost, do not grow back. The longer the delay in treatment, the greater the potential for irreversible brain damage, leading to more severe disability. This is why a stroke is considered one of the most time-sensitive emergencies in all of medicine. The clock starts ticking the moment the first symptom appears, and our goal is to intervene as quickly as humanly possible. The urgency of treatment has driven incredible innovation in how we respond to stroke calls. One of the most significant advances is the widespread use of telemedicine. Today, paramedics in an ambulance can use a secure video link to connect directly with a stroke specialist at the hospital. This allows the expert neurologist to see the patient, assess their symptoms in real time, and guide the on-scene medical team. This virtual consultation means the diagnostic process can begin before the patient even reaches the emergency room, saving precious minutes. The hospital team can be fully prepared, with the right treatments ready to go the second the ambulance doors open. Taking this concept a step further, some regions are now deploying mobile stroke units. These are essentially specialized ambulances that function as emergency rooms on wheels. They are equipped with a portable CT scanner, which allows the team to take an image of the patient's brain right there on the curb or in their driveway. This is a game changer because it allows doctors to determine immediately if the stroke is ischemic, caused by a clot, or hemorrhagic, caused by a bleed. With that information, they can start administering life-saving, clot-busting medication for an ischemic stroke on the spot, long before arriving at the hospital. Once a patient arrives at the hospital, the goal is to get them to a specialist stroke unit as quickly as possible. Research has shown time and again that patients who receive care in these dedicated units have better outcomes. These units are staffed by a multidisciplinary team of experts, including neurologists, specialist nurses and therapists, who are trained specifically in stroke care. They have the expertise to manage the complex needs of stroke patients, from emergency treatment to the early stages of rehabilitation. This focused expert care is proven to reduce mortality and long-term disability, highlighting the importance of a coordinated system of care from the initial 911 call to recovery. While the BE-FAST acronym covers the most common stroke symptoms, it is vital to know that a stroke can sometimes present in less obvious ways. These atypical symptoms can lead to dangerous delays in diagnosis and treatment, and they appear to be more common in women. Instead of the classic one-sided weakness, a woman experiencing a stroke might report sudden and overwhelming fatigue, general weakness, confusion, or disorientation. She might also experience nausea or vomiting, hiccups, fainting, or even a sudden bout of agitation. Because these symptoms can be mistaken for other less urgent conditions, they are often dismissed by both the patient and those around them. This highlights a critical gap that we must close: public education. While many people have heard of a stroke, studies show that comprehensive knowledge of all the warning signs and risk factors remains alarmingly low. We need widespread, continuous public awareness campaigns to drill this life-saving information into our collective consciousness. This education must be culturally relevant and accessible to everyone, addressing disparities in communities that are disproportionately affected by stroke. When every person is empowered to recognize a stroke, in themselves or a loved one, and knows to act immediately, we will save more brains and more lives. There is no doubt about it. We also need to shine a light on something called a transient ischemic attack, or TIA. Often called a mini-stroke, a TIA produces stroke-like symptoms that resolve on their own, usually within a few minutes to a few hours. It is tempting to feel relief when the symptoms disappear, but a TIA should never be ignored. It is a major warning sign that a full-blown, debilitating stroke could be imminent. 1 in 4 stroke survivors has had a previous stroke, and many of those events were preceded by a TIA. Treating a TIA as the medical emergency it is can provide an opportunity for doctors to intervene and prevent a much worse event from occurring. Ultimately, the fight against stroke is a shared responsibility. It involves medical professionals pushing the boundaries of technology with mobile stroke units and telemedicine. It involves public health officials creating effective education campaigns. But most importantly, it involves you. By learning the Be Fast signs, understanding the less common symptoms, managing your own risk factors like high blood pressure, and committing to calling for help immediately, you become the first and most critical link in the chain of survival. Your awareness and your quick action can make the difference between recovery and lifelong disability for someone you know. Knowledge is power, and in the race against a stroke, it is the power to save a life.